Okay, this question is how to code respiratory failure. Okay, the first thing you do is go to F in the index. Okay, then you find the word failure, then underneath that you read down to respiratory. Then underneath that you'll have different choices. There's codes for respiratory failure with hypercapnia, hypercarbia, and hypoxia. Then there are some acute respiratory failure codes. And then there are codes for acute on chronic, chronic, and post-procedural. So the one you code just depends on what your documentation says. But the rest of the question is, what's the difference between J9 6.0 and J9 6.9? Okay, J9 6.0 is not a full code, okay, but the codes underneath it, these are the codes for acute respiratory failure. Okay, and J9 6.9, again, that is not a full code. The full codes are underneath it. Okay, J9 6.90, J9 6.91, and J9 6.92. And these are the codes for unspecified respiratory failure. So J9 6.00, J9 6.01, and J9 6.02 are the acute respiratory failure codes, and the J9 6.90 are the unspecified respiratory failure codes. So your documentation is going to have to tell you whether or not the respiratory failure is acute.